In this video, we will talk about epidural hemorrhage, its causes, clinical features, imaging, management, prognosis and complications. What is epidural hemorrhage? Epidural hemorrhage is bleeding between the dura mater and the inner surface of the skull, typically arterial in origin. It is a neurosurgical emergency. It is most often associated with head trauma. It accounts for approximately 1 to 3% of all head injuries. What are the causes of epidural hemorrhage? Its primary cause is head trauma, leading to temporal bone fracture, causes rupture of the middle meningeal artery. What is pathophysiology of epidural hemorrhage? It occurs by rapid accumulation of blood in the epidural space, due to high pressure from the arterial system. This leads to formation of a localized hematoma that compresses the brain, increasing intracranial pressure. If untreated, it can lead to brain herniation and death. Clinical features. It has 3 stages, where it shows unique features in each stage. Initial presentation. It shows following signs. Classic sign: loss of consciousness, followed by a lucid interval, and then rapid neurological decline, severe headache, nausea, vomiting. Next stages of neurological deficits. It shows confusion, dizziness, weakness, pupil dilation on the side of the lesion due to compression of the oculomotor nerve. Last is the late signs. It has following signs: seizures, coma, respiratory distress. Imaging in epidural hemorrhage. It can be done by CT scan, primary diagnostic tool. It shows biconvex, lentiform, hyperdense collection limited by sutures. MRI. It is used when more detailed imaging is needed, to evaluate other intracranial injuries. Management of epidural hemorrhage. Emergency measures. It involves immediate assessment of airway, breathing, and circulation. ABC. Reduction of intracranial pressure by mannitol or hypertonic saline. Step 2. Surgical intervention, craniotomy. It is evacuation of the hematoma, and repair of the arterial tear, burr hole. It is used for emergency decompression, in critical situations. Step 3. Post-operative care. It involves ICU monitoring for intracranial pressure and neurological status. Rehabilitation for cognitive and motor deficits if present. Prognosis of epidural hemorrhage. Good with timely surgical intervention. Mortality rates increase significantly with delayed treatment. Complications. It has following complications: brain herniation, permanent neurological deficits, post-traumatic epilepsy.